Hi there, Victoria. How are you doing?
Hello, I'm good, thank you. How are you?
I'm very well. Now, it's been a wee while since we brought you onto a live, so I wanted to get the opportunity to really pick your brain. For those of our listeners that haven't met Dr. Victoria Sampson, she's an amazing dentist, and I really can say amazing. And whilst I send loads of adult clients her way, I just was saying before I hit record, I've got an amazing protocol. If I'm worried about anybody's oral health, I do an oral microbiome test and I tell them to book in with Victoria. And it's so simple. That is it. And then Victoria works her magic. And I have had amazing feedback on all of the clients I've sent your way. Today, I want to talk about children's dental health. And this is an area that, as a mum, I feel a little bit unknowledgeable about. And we've got loads of parents, whether that's children with cavities, whether that's knowing what to do. My 2-year-old, thankfully, I can brush her teeth twice a day, but I was reading a post on a Facebook group yesterday saying, I'm having to battle my child to the ground to brush their teeth. How do I do it? So, Victoria, talk to me about children's dental health, because children can get cavities right from a very young age, can't they?
Yeah, actually, I would say it's probably worse than in adults because a lot of the time they won't feel pain or problems. Um,
Ah,
yeah, and so because the nerves of baby teeth are a lot smaller,
yeah.
and so that's why also as a dentist, I often don't need to anesthetize them. I don't need to inject a lot of the time and I can do a filling without any anesthetic. But the double-edged sword of that is that they sometimes will not feel pain or problems. A lot of the time, parents will maybe unknowingly not take their child from a very young age to see the dentist. And
Yeah.
there have been so many times where the kid comes for the first time, they're aged, 7, 8 years old, and they've got 6, 7 fillings that need to be done. And that's a lot for a child to start their dental, journey with.
Yeah. Well, I mean, that's huge. It's double edged, isn't it? It's risk of the long-term implications of having dysbiosis in their mouth, imbalance their mouth, but it's also the psychological. I mean, come off it.
Yeah.
You can't tell me a child's going to make best friends with you if on the first time you meet them, you've got to do 7 or 8 cavities in their mouth. I mean,
None.
kind of quite damaging, isn't it, for their patient dental journal? So I've got loads of questions that are going around my head, and I know as a mum that's breastfed and still breastfeeds my 2-year-old, one of the things that was really important for me was to make sure I wasn't feeding her to sleep so that I could feed at night, stop feeding, brush teeth, put down, awake. Was I doing the right thing? What about parents that say to me, because I have lots of people who go, but the only way I can get my child to sleep. So I'm now thinking of, tiny tots, but they've got teeth. What do you say in those circumstances? And is it detrimental to feed a baby to sleep?
It is just because even if it's a mother's milk, there is still enzymes, there is still natural sugar in that milk. And what happens is that they will basically, just like like an adult too, if you drink anything and you go straight to sleep, that sugar, those enzymes are able to sit and just kind of fester on those teeth. And then the added problem is that when we sleep, our saliva is reduced significantly. And even a baby as well, their saliva is reduced. And saliva is our best friend. And saliva will neutralize all the acids in your mouth. It will help kind of shift the microbiome back into a balance. But if you've had, something like milk right before going to bed, and then you have a really dry mouth, and you do that constantly, once in a while, it's fine, but overall, generally, it should not be a daily thing. So I always say, up to the age of 2, if you need to breastfeed, that's fine, you can. After the age of 2, you need to start trying to wean them off and getting them onto a sippy cup. You can start doing like what I like is doing, you can start with milk and then you can just basically start to titrate and dilute that milk into water. So after about a month or so, you're basically putting your baby to sleep with a bottle of water.
Yeah.
And they don't realize if you do it slow enough. So that's kind of the way I would recommend to do things.
Nice. And then you've always got the opportunity as well to, if they're not dependent on milk to go to sleep, to then brush their teeth after you've
Yes.
given them the last whatever it is. So if we
Yes,
stick with those littlies, because obviously children are like a massive sliding scale, aren't they? We stick with those littlies. There's always the like, when do we start fluoridating? Should we use fluoride? Obviously, if children can't spit, what would you look for in a dental product to look after a young child's teeth at this point?
So, in terms of the kind of fluoride argument, I still do recommend fluoride to a lot of patients. I don't think that any children should be ingesting fluoride. So that means no fluoridated water, no, there's even some fluoride supplements that they recommend to some people. I wouldn't recommend any of those, but having a topical application of fluoride through your toothpaste is quite important. And I've seen so many kids who don't have that, and it sets them up kind of for failure later on, because fluoride is extremely important for helping remineralize and strengthen the teeth. With that being said, you don't want to have a high amount of fluoride in the toothpaste. So I will always go for a lower amount. I just want a little bit. So I would look out for, you want to get an age related toothpaste. So usually it will say like 0 to 3 year old, 3 to 6 year olds, or 7 and above. So always follow that. The amount of toothpaste that you use is quite important. So if your child is 0 to 3 years old, you literally want to smear like a tiny little, a little dot of toothpaste, not too much. And then from about 3 to 6 or 7, you want a pea-sized amount. And then from 7 up, you can start to have kind of 2 pea. And when I say pea, I mean like a green pea, not a pea. Like so then I would say you want low fluoride, but still a little bit. No sodium lauryl sulfate in the toothpaste. Ideally, if there can be some other remineralizing agent, so something like calcium, phosphate, you can get hydroxyapatite in your toothpaste. Those are really great. So I've got some of my like top favorite ones. And those would be Biomin Kids. They have a really nice one. They've got like melon and strawberry flavored, which kids usually really like. And then there's also another one, if you still are a bit on the fence with the fluoride free or the fluoride argument, which is completely fine, then you can go for the Get Super Teeth toothpaste. It's like a prebiotic and a probiotic combined toothpaste. And it's got hydroxyapatite in it, and kids can use it too. So it's quite nice, and it's quite a mild mint. So a lot of kids can accept that.
Yeah, and I guess that's quite good. And I've always used hydroxyapatite, actually, not those brands you've said, so I'll look out for those ones next. I've used hydroxyapatite from a baby serum that was designed for kind of the first 2 years, and now I've gone into the like toddler hydroxyapatite toothpaste. But interestingly, they're not mint. And I found it really difficult to translate my older daughter onto mint because she was sort of used to the non-minty one. So then when you came to a more adult toothpaste, she's like, I'm not having mint, I'm not having anything like that. And it's not quite, you have to use kidology, don't you, when transition? Is there anything else that we whether now we're thinking of the younger ones or starting to get into the slightly older ones, we all know that brushing our teeth on a twice daily basis is essential for looking after the longevity of our teeth, but is there anything else that you would be encouraging parents to do, whether it is a necessity at a young age or a behavior setting for an older age, other than, of course, come to visit a dentist?
I would say, so you're completely right. Starting that brushing habit from early on is the most important thing. The issue sometimes is that people say they're brushing their teeth, but they don't brush their teeth very well, and they start that habit from young. And I sometimes see, 40, 50-year-olds who actually still don't know how to brush their teeth. So I think what's quite important is that as the child is quite young, so around up to the age of about 6 or 7, you want to slowly start to get the child to brush their teeth themselves. And you can give them a normal toothbrush, brush, brush, brush. And then you should go over their brushing yourself and brush again. It's also quite nice to brush in front of them. So I always recommend that parents brush their teeth in front of their children to show, it's a normal habit that everyone has. Then you get the child to brush their teeth, and then you repeat and brush just in case they've missed anywhere. Nice. And then from the age of like 7, 8 above, they should be able to start brushing their teeth themselves. I would still watch them. And then, up and, once we get to the teenage or the adolescence, you're hoping at this point they can brush their teeth, hopefully.
Yes, like a muscle memory should be fixed.
Yeah, hopefully. Yeah.
And from with regard to, you know, there's so much out there. You walk into a pharmacy and it's surrounded by obviously all your toothpaste, your mouthwashes, your electric toothpaste. At what point would you transition from a manual to an electric toothbrush with children? And is there anything else that you would say is good practice or really bad practice? Because remember, there's so much marketing out there, isn't there? Which I'm sure you must gulp at some of the marketing around dental products that are out there on the market.
There are some interesting products on the market these days. I would say so in terms of mouthwashes, generally children shouldn't need a mouthwash. I am a strong advocate of mouthwashes, as you probably know from a lot of the treatments I do with adults, and we do the microbiome testing and we kind of prescribe a mouthwash based on that. But a child's microbiome is still very much growing. It's evolving every day. And what you don't want at that point is to start to eradicate some of the good bacteria and to cause problems. So no children should be using mouthwash unless maybe a dentist recommends, and that should be a specific case-by-case situation. As we said, the brushing is pretty normal. Flossing, you want to start flossing once the adult teeth start to come through. So when some parents will be like, "Oh, I floss my child's teeth every day," and I'm like, "But they don't need it at this point, and you're kind of tiring them out, and it's really difficult for the parent to floss too." But the idea behind flossing is that you're getting in between the teeth to get rid of the food that's stuck in there and the bacteria. But kids, when they have baby teeth, the idea is that their teeth are spaced. So we call it primate spacing. And you've probably seen with your child, they're quite gappy. They've got, in a sweet way, quite goofy, gappy teeth, and that's what makes children's teeth look so sweet, but it also means that they don't need to floss, which is fantastic. Once the adult teeth come through, they're much larger, and that's when you do need to start getting them to floss. And I like the little floss picks. Kids find those quite easy because normal floss, the manual dexterity that's required is pretty hard for the average person. So a little floss pick works.
Perfect. And what about electric toothbrushes? Are you an advocate? Are you an advocate in all? I know I've seen your pictures of electric toothbrushes and kids on Instagram. So tell me what we should be telling our people about them.
So I always recommend that every child should be able to brush their teeth normally with a manual toothbrush. I think it's very important that, you're stranded on an island, you know how to brush your teeth with a manual toothbrush, and you should have those skills before you start to get a bit lazy and rely on electric, toothbrushes. So up until the age of about 8, so again, 7, 8, they should be using a manual toothbrush. They should learn how to use it. Then you can start introducing electric toothbrushes in. There are a lot of children who don't like the vibrations that an electric toothbrush has. I would say for those children, stick to the manual. It's completely fine. But for those children who maybe need that extra support and, support, then the electric toothbrush is a great option for them. So I would go for that around age 8-ish.
Okay, awesome. Now, we've talked about great products, we've talked about great practice, but there are going to be people out there that have children that already have less than good set of teeth on them, whether they're baby teeth, whether they're adult teeth. And what I want to share with our listeners is, what do we do in those circumstances? Because as a parent, we use anything to eat ourselves up with guilt. My eldest daughter had to have some teeth out under general anaesthetic many years ago. They were baby teeth, but that was linked to medication that she was taking from a very young age. It was nothing to do with, these preconceived, the juices in bottles, the lollipops. Like, she didn't do any of that, and she still had to go down dental surgery route. So it isn't always our fault when our children have got cavities or infections in their mouth, but there are going to be people out there beating themselves up about what they have and haven't done in the early years with their children's teeth. What would you say in those circumstances?
What I'm starting to see a lot more in the last year, and I'm actually collecting data on it, is the healthier the parents are. And I'm talking, a lot of patients, people that you are referring to me, people who are clearly in tune with their health. Interestingly, a lot of their children have hypomineralized teeth. So what that means is they lack minerals in their primary or in their adult teeth. And I'm seeing more and more of it every single day. And that there's kind of a few causes of hypomineralized teeth. And the first is that the mother may have had some sort of trauma during her pregnancy. So that could be she had to take antibiotics, she was very sick, um, anything like that. The second is during the delivery of the child, something happened where maybe there was lack of oxygen to the baby, or some sorts of, even when they were delivered, they had really bad jaundice or they were really sick, anything like that, which would again impact the development of those primary teeth. And then the third one is just trauma. Just, you know, kids at the end of the day, they knock their teeth. They might not, you know, and I'm definitely seeing weaker teeth generally with the general population. So I definitely, you know, you should not beat yourself up about it, because a lot of the time, you know, if you're really sick and your child, you know, you deliver your child in a bit longer or more difficult scenario than you would have liked, that's not your fault. But unfortunately,
and it's all about getting them out safely at the end of the day, isn't it?
exactly, yeah. And at the end of the day, we can fix teeth, we can replace things like that, but there's a lot of other problems systemically that we wouldn't be able to fix. So in the grand scheme of things, it's a good problem to have. But I see it a lot where parents completely beat themselves up about it. They feel that, you know, I think there's also a kind of stigma and a confidence issue where if their child has these kind of mottled yellow or white marks on their front teeth, then these kids are bullied and the parents are seen as being, you know, not taking care of their kids well enough. And it's really such a shame, but it's happening more and more these days. So I guess maybe there are some things, by the way, to help those kids. So one thing is tooth mousse, which I'm obsessed with. Tooth mousse is calcium phosphate. It's from milk proteins. So if you're lactose intolerant, you shouldn't have it. But it really helps to strengthen the teeth. They have really nice flavors. And for people who lack those minerals in their baby teeth, you can literally smear this tooth mousse on their teeth and let them go to sleep with it. And it really helps to strengthen it, helps with the sensitivity, and it reduces the chances of their adult teeth having the same lack of minerals as their baby teeth do.
Amazing, amazing.
Yeah.
And you see children, don't you? You know, as a dentist, parents can bring their children to see you. Parents can obviously support whatever state their children's teeth are to try to get the best possible outcome for the teeth that we've got available.
Yeah.
Wow, there's loads in there, because actually my older daughter did have hypermineralization of her teeth. It was linked to celiac disease, which is another. Sometimes it's a picture of something else going on.
Yeah.
I didn't know she was celiac when I first started to notice these blemishes on her teeth. So it is a combination of good functional medicine and good dentistry to give people the best possible outcome. Wow, you've given me loads to work on. You've given me you know, I can be supporting my children's teeth moving forward. And there's so much in there for our listeners. And I will actively encourage anybody wants to go see Victoria, please link through our website. She has an amazing practice. And like I said, we send so many clients to her. I have such amazing results with all of them, apart from one that you've just finished dental work. And she's like, I've spent about 15 hours sitting in Victoria's chair. She says, me and that chair have a big relationship right now. So absolutely, please, 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 don't sit at home with dental problems. Let's get them sorted out. And particularly today, let's think about our children's teeth. Thank you so much, Victoria. And thank you to all of our listeners. And please, please, please do share, because I've learned things and I thought I already knew a reasonable amount, and I've learned things. So other people will definitely